I'm Ryan Carlson with Health Jump, and we're here today with Jean Drouin from Clarify Health Solutions. So thanks for coming in and talking to us about what you're doing with health data.
Thanks for having me. Great pleasure to see you guys here today.
Yeah, I would like to know, who the heck are you? What do you do?
Terrific. So think of us as essentially having put the equivalent of a Bloomberg terminal on top of one of the largest ever patient-level data sets in healthcare. So we now have 300 million American lives worth of patient-level data where we can bring together claims data, lab data, prescription data, EMR data, and then social determinants of health, not just at zip or block level, which is how many other people do it, but at the individual level, like a bank or Amazon would, to understand behavior. And with that combination of the technology stack we've built and the data, we are able to deliver a set of business applications to our end customers. So our end customers are hospitals, payers, life science companies, and the business applications we sell to them answer fundamental questions about their business. So for payers, one of our most successful products is our network design analytics, where the payers are picking and choosing who are the top doctors to put in their plans. And what we've helped solve for them is being precise enough that they can score those docs in the same way that baseball teams are applying Moneyball to score their players.
So is it that you have specific information about a specific provider, or is it a model that is informed through real-world evidence?
Okay, terrific question. So one of the initial premises or founding ideas of Clarify is that if you could far better turn massive data into insights about patient journeys, if you have individual patient journeys and can stack them up, you can then far more precisely answer questions about anything that's going on with a population. So if a payer says, I want to know who the best doctors are, you can spin the cube, if you will, around the doctor being the endpoint. At the same time, though, if a life science company says, hey, I want to understand how my drug does for certain types of people, you now spin it around the drug as the outcome. So think of us as having a technology stack that is data, then a processing ability that uses machine learning AI and a grouper, and then ultimately you're able to surface into the workflow the insight that answers the question at hand. So is this the best doctor? Is that the right drug? Etc.
And my understanding of machine learning is it's always the amount of data you have access to and the quality of your data is almost an exponential relationship with the insights that you can generate, right? With 350 million records, that's amazing. Who is it that your primary customer would be? Who is it that you serve with all of this cool stuff?
So think of it as maybe anthropologically. What we're trying to do is somewhat similar to what the Bloomberg terminal did in banking, which is to enable the analyst at a provider, a payer, or a life science company to self-service on demand, turn big data into actionable insight. Whereas what happens today, and the problem we're solving, is often what will happen actually is a customer will say, oh, Clarify, you're the new kid on the block. And the industry is completely wired to say, what data do you have? I will do an overlap analysis of the data that I have with what you have, and the sliver that's different, maybe I'll buy it, and then I'm going to bring it into my data lake. And then I'm going to have either some of my analysts or last-minute consulting support go in, SQL query for 4 to 6 weeks in a dark room, and then come out with something that still looks like a spreadsheet and might be prettied up in Tableau.
With 6 to 8 weeks of invoices.
Correct, absolutely. Imagine a different world where somebody can log in and either automated or very easily through filter, a couple of seconds goes by and out pops the same analysis that would have taken 6 to 8 weeks of time and invoices in the SQL world. And that's effectively what we've built, is the capability or the intelligence to turn data into insights, self-service on demand. And so, to use an analogy often used about doctors and nurses, we enable the analyst to now practice at the top of his or her license and do away with the drudgery and the manual labor of ingesting the data, cleaning it, stitching it together, etc., because we've automated all of that. Now, why have we been able to do this? I was enormously fortunate when I started Clarify 6 years ago to be introduced to the Chief Technology Officer of what was then the leading cloud analytics business in financial services. And when that company was sold, Todd, my co-founder, who was the Chief Technology Officer, came over with the CIO, the head of engineering, the 3 lead engineers, and the 2 top product developers. So in a way, Clarify is the translation of the power of financial services analytics into healthcare, with the bringing together of this massive data set. And to your point, to be able to do machine learning and AI in a precise enough way, you need that large enough data set. Absolutely. And part of the reason that we love what you're doing at HealthJump is that for the category of data that is EMR data, you are enabling your own customers to get value out of it in a way they didn't before. You're also making it possible, though, for that data to now be extracted, and it would be possible to union it to the kind of data that we have to enable some even more powerful use cases. So it's actually a pleasure to be here with you today.
Well, thank you. So if I had a bunch of data trapped inside of my electronic health record system, are you saying that I could then take my data, put it up in the cloud? Let's say, we used HealthJump to pull it out and put it into a standardized format that could then be married up. Would it be that I could then run an analysis against your data set to go, help me compare where am I strong, where am I weak? Because you said you're not licensing your data, but it's leveraging it to help train or gain insight from my own data.
So here's one thing we could do. You all use Datavant tokens as we do, so we could theoretically link those 2 data sets in a secure cloud, and then absolutely either run our or your models on top and derive a set of insights that would now be the union of the insight that's in the EMR data with the insight that's in all of the claims, lab, prescription, and social determinants data that we have.
So at no point am I getting your data. I'm getting the benefit of it.
Correct.
So I had a conversation with Cliff, our CTO, about this, trying to understand this idea of training, like machine learning models, and how do you leverage data you have to create insight, but without ever giving access to that data. And here's what I came away. Are you familiar with the dog whisperer, Cesar Millan?
I'm not, actually.
So he comes in and he helps people with these troubled dogs. They usually have a sordid past or have been treated wrong or whichever, right? And he rehabilitates them. And the way it works is, anyone who's seen the show is going to go, oh yeah, I totally know this. So he brings this dog, the owner comes up to his facility and he's got this big fenced in acreage and he's got 100 dogs that have all been rehabilitated and trained. That's his pack. Okay, so they all have the skills and knowledge of how to be a good dog, how to be a good member of the pack. And so he goes out and leaves the owner on the curb going, bye, and then they always do the reveal, the extreme dog makeover. They bring that dog in and they learn how to be a good dog from his pack. And then they get to walk back out and he hands them over the new keys to the brand new dog. With the new behavior, the dog doesn't bring the pack with them. They stay inside that walled lot. The dogs are never in motion other than in the, right? So I think it's a kind of a cool extrapolation to think of like, how do you not bring 100 dogs home with you, but you still have a better data model?
100% on the data models. And then the other analogy you might use is it's possible in almost a Snapchat-like fashion to start with a source data set. you do a set of manipulations and calculations, and you end up with a derived insight or a derived work, and the process by which that happened disappears. And so it's impossible to re-identify any individual information that led to that derived work. So I love those two analogies because it's part of the explanation for why today we're able to have this discussion in a way that if we'd been here 5 years ago, people would have said, what are you guys talking about?
Yeah, it's fascinating. Tell me, there's the technology challenges and then there's business model challenges that a lot of businesses are addressing. What is it about what you're doing at Clarify that uniquely allows you to address this problem? Is it that you've got a different business model, pricing model, or is it like something unique in your technology stack that really allows your solution to stand out amongst anything else out there?
I would say it's a couple of things. Number one for us is the team. Okay. The fact that the team of engineers and data scientists came out of financial services and had built that platform at scale for hundreds of banks and hedge funds gave us an ability to approach healthcare in a different way. And just a little nugget on that one, when we described social determinants of health to the team, they said, oh, okay. And they went off and they came back and we said, wait a sec, how did you pull off the stunt of doing it at individual level instead of zip code level? And they said, oh, but that's what we did in banking to automate who gets a credit card and who gets a mortgage. Okay. So team is number one. Number two then is, you're absolutely right, is the technology that team then translated and innovated into healthcare, if you will.
It's know-how and a lack of ability to reproduce, right? It's that.
Absolutely. Sure. And one thing that's often missed, and it's a technicality, but there's the power and speed of the platform, but there's also having a grouper in there. A grouper in healthcare is like a ledger for blockchain.
Oh, okay. I never knew. I thought it was a fish.
And it allows you to more rapidly organize into your patient journey, my patient journey, his patient journey. And there's only 3 other companies that have groupers, right? So Optum, there's Prometheus that was bought, and 3M. So that's a massive difference ultimately in our ability to very quickly personalize the insights that we're generating.
And to clarify, it's not the evil Skynet AI takes over the world, because your data set doesn't allow it to sell to you and me. It doesn't allow a marketing company to go, we want to know how to sell to Jean.
100%.
But it could be people like Jean are prone to this type of behavior, activity, depending on where you are. Is that more accurate?
No, that's right. And this is one where I believe that HIPAA is actually philosophically in the right place, which is HIPAA says, for the purpose of improving care, making sure the billing was okay, or research, the kinds of things that we're talking about are fair game. It says, though, if you're about to go and market, then now we're on the other side. We have spent a lot of time building into the platform the safeguards that ensure that we're on the side of the use cases that are absolutely HIPAA compliant. For that reason, we have not focused on use cases that are more about marketing.
And ultimately, you get to control which use cases
absolutely.
It is. So you have your own, is there an ethics board or an ethics committee or someone that helps provide that level of oversight on where you can say, we say no to all projects that look like X, Y,
I love that you asked the question. We've just set one up.
Oh, congratulations.
And we have
good first step.
A mix of internal clinicians and then some external folks. And look, it makes a ton of sense because it's an important true north.
So what does getting started look like for your average
customer?
Yeah, what does that journey look like?
It's actually relatively quick when you think of the typical implementation for software as a service.
Okay.
Usually, let's say it's a hospital that has brought in our referral optimization analytics. Typically, there will be analysts in the strategy or finance team and we would come in. Now the pandemic taught us how to do this remotely, but train them on literally how to use the software in response to the kinds of business problems that they have. And
which they may not have identified had there not been forced into this situation.
Absolutely.
I think it's a 10-year timeline of like technology roadmap compressed down into a couple of years. Just how many times have you tried to explain what you do pre-pandemic when it was still acceptable to keep like files in paper form, or like you just assumed that you could always go back to some of the manual processes. Sure, we need to go digital, but we'll get there.
Yep.
And then it was wake-up call time. And so that pain that people feel is close enough to the pain that you solve.
Yes, and so very much so. The ability, I would even say the believability of what we do has gone way up. Partly, and one interesting thing too is we used to have this notion that for a customer to gain enough trust in us that they would want to bring us in, that it had to be a face-to-face interaction. And you know, I think the pandemic proved to us that in certain circumstances, it's possible to do just in the 2 dimensions of Zoom.
What's that? We can trust humans to not take advantage of being at home in their pajamas and just turning their camera off. And sorry, I'm still scarred from remote learning from kids, right?
Right. So, now, having said that, it is really nice to be able to interact like this again. I'm hopeful that we're going to come out on the other side and that this will open up a better work-life balance for folks, because there'll be more flexibility, and we're seeing that with our customers and with ourselves. Yeah.
I'm realizing that I jumped right in. So someone identifies the problem, they bring you in. Is there like a class, or is there onboarding?
Absolutely.
I just want to get an understanding.
We have what we call Clarify Academy, which is both direct right now online and then virtual, where you can go asynchronously at your own pace, and you can acquire qualifications or levels of proficiency.
Cool.
And typically it's a 2-month onboarding process. And then as any technology company, we then have a customer success, customer care department.
Absolutely.
And people can call and say, hey, I'm working on this thing, et cetera. And then obviously there's a set of new releases of additional functionality as the quarters go by.
So probably about the second quarter, they're now making their own queries and getting their own insights. And then if they got a problem, they get on the phone and you've got a customer success person that's walking you through it.
Absolutely.
It's almost as if it's a model that has been proven to be successful.
So it's interesting, because in healthcare, we often get told rather than asked, oh, you have to have an army of MBAs with clipboards now providing services to ensure people achieve the impact. And this is actually one of the things we were seeking to prove, which is that no, you don't have to have an army of folks with clipboards, because you can enable your own team. This is this concept of practicing at the top of their license to deliver the insights into the workflows they need to.
What I love about what you're talking about is a theme that I've been sensing, which is you're not just buying a product, you're buying the ability to create a new capability that you didn't have before.
Absolutely, yes.
And it's that human in the loop, data analytics thing that I see is just mission critical, right? Data turns into information, insight turns into knowledge, right? Somewhere in there, a human has to be involved.
Very much.
Whether it's a data scientist or providing the context behind things. But AI is awesome at turning data into information and information into that, like that gap into, there's variances here that may require us to think, well, why is this happening?
Yes.
Which I love. Anyway, I really think that this is the way things are moving.
Yeah.
And I'd say the success of using data and real world evidence, like it is the thing that we're moving to, and I see it's inevitable. So thank you so much. How would people learn more about Clarify Health Solutions if they wanted to learn more?
Probably the easiest thing is to come to our website, www.clarifyhealth.com. Some really interesting videos on there. And even better would be to reach out directly. interestingly, what we found is it's when people see the actual software that we have that they light up and they say, that is possible? Seeing is believing, ultimately.
Well, that's great.
Yeah.
You heard it here first. Seeing is believing. You should check it out. So thank you so much, Jean, for coming in, the Chief Executive Officer of Clarify Health Solutions, for sharing about this whole new world of our great data overlords, insight generators. Thank you so much.
Thank you for the opportunity. Really appreciate it.